December 13th, 2015, and I am 4 months post-op top surgery. Um, yeah, I mean, I've experienced a bit of pain in my chest over this past month, and also I'm getting feeling back in certain places. Um, my nipples still look completely different from each other, and that's never going to change. That's never going to change. I have accepted that. Um, Other than that, I'll just show you what it looks like and go from there, I guess. But this is what my chest looks like 4 months post-op. I've noticed that the thickest part of the scar is still right here on this side here, like this little span there. But I have noticed that to me when I look in the mirror, these like this part here and then at the very ends there have kind of faded. They're not as red and harsh as they were before. Um, it may be just my mind playing tricks on me, but this little section on both sides of or both scars, I should say, definitely looks a bit lighter than it used to. I'm still using the bio oil. I don't use it every day. I should, but I don't because I forget. But when I do remember, I do use it. I do it at least a few times a week. Um, as you can see, the shadow there, this little bulge of um, the lady said it was fluid under there. She said it would go away on its own. It hasn't really shrunk at all. It doesn't bother me anymore. I really don't care, but it is still there. Um, my nipples, I really don't want to get like right close up to the camera, but there is like brown stuff, and I don't know if that's like dirt or like they're kind of dry, and I did kind of put some bio oil on it, but it feels weird when I do that. And I don't know if it's like dirt buildup because I'm not like scrubbing them in the shower because touching them makes me uncomfortable because not all the feeling is back yet. So I don't know like what is actually on them that's making them like discolored the way that they are, but yeah, I don't like touching them. And speaking of feeling, I have like I can feel that now, whereas before it was numb. This side is much more numb than this side, but I can feel that like a bit. My back is itchy. Sorry. Um, I can feel it a bit. Before, like I couldn't feel anything at all. Now I can feel this weird like sensation, but it's not the same as if I'm touching other parts of my body. It's still kind of numb in this general area, but like if I tug on that, then I can feel my skin pulling, whereas before there was no feeling whatsoever. This side is still numb under my armpit and up into my back. Uh, it's less like same as this part here. Like it is, the feeling is sort of coming back, but it's still pretty numb. Uh, yeah, I think that's pretty much it. Um, and my chest is still really kind of dry here. I need to do something about that, but I'm still nervous to like. I just really don't like touching it with other things. Like touching it with my hand is kind of fine, but I really hate the feeling of things touching my chest because in the places that it's numb because it really grosses me out. I don't know why. It just makes me so uncomfortable to know that something is touching me, but I can't feel it completely. And it's just this weird like pressure on your chest, but you can't actually feel it. Which, if you don't know the feeling, you think I'm crazy for saying that. But once you feel that, you'll know exactly what I'm talking about. Like it just makes me so uncomfortable, and it feels really strange. And I tend to like hit my chest by accident a lot with things. So like if I'm picking something up or if I'm walking past, I walk into things all the time because I'm clumsy, and I'll walk into something and it'll like hit my chest um, in a place that it's numb, and I know that something hit it because I felt the impact, but at the same time it's numb there, so I didn't really feel it at the same time, and it's just strange and I hate it. I just really cannot wait for everything to just be back to normal. That's probably my least favorite part about top surgery is just the numbness and the fact that it just won't go away is really frustrating to me. Um, but other than that, I'm really, really happy with the results. Like, I don't think about it much. Yeah, I put the bio oil on every once in a while, or a few times a week or whatever, whenever I remember. Um, but I don't worry about the scars too much. I'm actually quite impressed with the way that they look. And yeah, the only other thing I'd like to mention is I must have really hurt my ribs binding because when I laugh too hard, like I am in severe pain. Like my ribs get that feeling, and I don't wear a binder anymore, obviously, but that feeling comes right back to the days when I was wearing a binder and I was having trouble breathing, and every time I'd laugh, it would hurt so bad. And I'm so thankful to not be wearing a binder anymore. But man, like it's still painful months after I've stopped wearing it. And I I don't think there's anything I can do about that. Like I wore the binder. I wore a Underworks tri top, which if you've worn one, you know how tight those things are. I wore those for 2.5 years, almost every day for God knows how many hours. Um, so yeah, it's I'm still feeling the pain from that. So I'm enjoying not having to bind, but I'm still reminded quite often of that time because I'm still in pain from it. And um, yeah, sometimes I still like feel like I'm having trouble breathing, and I get that feeling again of like having the binder on, not being comfortable. But I don't think there's really anything I can do about that. So just an observation of mine that I have not forgotten at all the pain of binding. But anyway, so 4 months post-op with Dr. Hugh McLean in Mississauga, Ontario. If you have any questions or comments specifically about the McLean Clinic or the procedure, or just questions for me and my top surgery experience, let me know. If you have any video topics or just general questions or comments, then leave them down below or message me. Thank you for watching. See ya.